Really thrilled to welcome you to our first ever webinar for Women's College Hospital. And today we are featuring Women's Virtual. First of all, I'm going to start off by introducing my fellow panelists, those I'm interviewing today who are going to be in the hot seat to answer all these great questions. We're going to start with Dr. Sacha Bhatia, who really needs no introduction at Women's College Hospital, but I will anyway. Sacha is our Chief Medical Innovation Officer for Women's College Hospital. He's also the co-founder of Women's College Hospital's Institute for Health System Solutions and Virtual Evaluation, which we affectionately call WEAVE. And he is also a practicing cardiologist, and just because he could, he got his MBA. And joining him today is the person who really brings Women's Virtual to life for those of us who actually interface with the hospital, Laura Puss, the Administrative Director for Women's Virtual. Welcome, Laura and Sacha. So Sacha, I'm going to set things up. We're going to start off with, going a little bit into the past. Most of the people who are joining us this morning know quite a bit about Women's College Hospital and about our history, but I want to just sort of set the table. So we are a unique hospital, and we have a unique position in the healthcare system. We were created not just because we have a real history for focusing on women's health and equity, but we were created to really help solve some of the big problems in the healthcare system. That's why we're completely ambulatory and outpatient, and that's why we have right in our DNA being Canada's first virtual hospital. Can you tell me, how COVID-19, which, came upon us in the last couple of months and has been a real defining moment in healthcare from which we have to, make huge changes permanently. Can you tell us how COVID-19 really was a catalyst for crystallizing all the things that this hospital was built to do?
Yeah, absolutely. And thanks for the question, Jennifer, and thanks for everybody on the webinar today. So, as many of you know, Women's College has had a history over the past 6 years of really focusing on innovative models of care, particularly in the ambulatory outpatient space, to try and improve the quality of care and reduce costs in our healthcare system to meet serious healthcare needs. And we had been focused with a strategy on this idea of Women's Virtual, which is really to bring care to patients in their home and to be able to bring care to where they need it as opposed to bringing them into hospital. And, a lot of people question, well, is this virtual care thing really going to take off? What are you guys really doing? Are patients going to like it? Are providers going to like it? And so, to be honest, I kind of felt as we were going around the country talking about, the work that we were about to embark upon, there was a lot of skepticism. And then we had this global pandemic, which scared people into not wanting to come into hospital, and yet still people with chronic diseases needing care. And suddenly, just like Zoom, as many of you have probably been on this Zoom call or other companies, we just started to realize that our strategy completely made sense in a COVID world. So the onset of the pandemic has subsequently accelerated the strategy or the need for our strategy so significantly. So, because we had done the legwork in advance, and Laura will talk a little bit about that, we've been able to virtualize almost all of our clinics. We've been able to provide care to patients with cardiac disease, mental health disease, in the comfort of their own home, protecting patients and providers while still maintaining the same level and same quantity of service visits, not leaving patients behind. And we've been able to build unique programming based on our specific strategy. And it is a strategy which we can talk about in some detail. And I think as a consequence of that, I think Women's is really being looked upon as a model of how to do this, not just now in the throes of the pandemic, but in the future as well.
Yeah, I mean, I'm seeing a huge upsurge in people calling me saying they're seeing what we're doing, and they're realizing that, the healthcare system really hasn't changed very much since the 1950s. and all roads have always led to the hospital. And when you have a pandemic and no one can come into hospital, we realized that, we were stuck. And 2 years ago when I started here, it was a very different conversation. People were thinking virtual was a nice to have. And now people are saying it's absolutely necessary. So it's been wonderful to turn that page. All right, I'm going to turn to Laura, who has the daunting task of taking all the grand ideas that we have about becoming Canada's virtual hospital and the necessity that's been demonstrated to do that, not just for us, but for the entire healthcare system. And I'll be bold and say really the world. I mean, I think the world is looking for solutions. The world is looking for ways to make sure we never find ourselves here again. And I know that when we were building women's virtual, 2, 3, 4 years ago, you went around the world and visited hospitals to make sure that we had the model that was not just sustainable, but that can be transferred to other areas. So Laura, I'm going to put you on the hot seat now. So we're in the midst of this global pandemic. We flattened the curve, but we're not sure where we're going. Can you tell us some of the details about what we've done, which has been so amazing over the last couple of months, to really ramp up women's virtual in such a short period of time and make a huge impact beyond our hospital?
That's a great question. Thanks, Jennifer. So I think really our virtual care journey did start, as you mentioned, 2 or 3 years ago when we did our kind of global environmental scan. We visited countries around the world to really see what are people who are leading in virtual care doing. And one of the biggest learnings that we found was that there were no actual leaders in true health system transformation. There were definitely pockets of innovation that you see around, but there wasn't a lot being done in true system transformation as far as virtual was concerned. So we really saw an opportunity for women's to become a world leader in virtual care. And then we spent really the better part of last year coming up with a very detailed strategic plan. We did this in partnership with McKinsey consulting firm so that we knew we were on the right path. And we have a very detailed 3-year strategic plan. It's all the elements of our strategy have been fully costed out over the next 3 years. And that is really what has set the stage and enabled us to scale virtual so quickly across the hospital. So some of the things that we've seen, so we know that 75% of our visits are virtual. So that means 70% of our patients can continue to receive care without ever having to step foot on hospital ground. And we're also seeing very few calls. We set up a new patient support help desk line. We're actually seeing only 2% of patients needing to call in and assist with some of those problems. So I think that's a really big indicator that our patients are not, there isn't this, lack of understanding of how to use virtual tools as it relates to your care, which is one of the biggest questions that we kept getting from our providers before, and one of the big concerns, but we're not seeing that come to fruition. Our patients are able to, for the most part, able to get on and receive virtual care. Some of the other things that we've been working on since virtual struck, we actually launched the first ever group video visit, which is group care is something that's really important in mental health programs. So we launched the first ever group video visit in Epic history, integrated within our electronic medical record, Epic. So that had never been done before. So we're really leading in that area. We were the first hospital to have an online assessment tool for COVID-19 in Ontario. And we've had over 14,000 people complete that online tool to see if they should come in and be tested. We've seen over 2,000% growth in our video visits overall since we started. And I know Sacha's done quite a few video visits in cardiology. So I think we're seeing really great uptake, and really what's enabled is the thoughtful planning that we put behind this. And we have a roadmap that clearly outlines where we need to go next and how we can continue to respond to the pandemic as the needs continue to shift.
So one of the things that I've heard over and over that people are very impressed with is our response outside of our walls. I think that people think that virtual is truly to keep everyone out of the hospital. And what I've heard from the leadership in the hospital, it's not that. It's to only have the people who need to come to the hospital end up at the hospital. So we don't have what we know as the hallway medicine, the emergency room backups. And in COVID-19, we don't have people who don't need to be in a hospital coming down here. So can you talk a little bit about what we've done in long-term care, which has been such a big part of COVID-19 and where we've seen a lot of vulnerable people really impacted? Can you talk a little bit about our work with that community?
Yeah, absolutely. So, part of our original women's virtual strategy, we identified seniors and elderly and people living in long-term care as an area where we needed to invest some of our time in a particular area of strategic focus, especially as it relates to virtual. So we established the Long-Term Care Plus program, which is a partnership between hospitals and long-term care homes. And the goal is to prevent transfers to emergency departments. I'm sure many people on the call are aware or may have a loved one or a friend who's in a long-term care home. And if there's a transfer to emergency department, there's often a decline in the patient's health status as a result of that emergency department. So we really partnered with our long-term care partners in our local neighborhood to leverage our virtual resources and our expertise in virtual care to provide medical backup to some of those homes. And then when COVID-19 hit, all of a sudden this became much more, the sector became much more important, and we were able to expand past our local neighborhood or Ontario Health Team as we had originally been planning for our strategic rollout, and we're able to expand across the whole Toronto region to support all of the long-term care homes that are in the downtown or in the core Toronto region or the Toronto Central Lynn area. So that's over 30 long-term care homes that we're partnering with in offering one number to call access for medical supports, navigation services, and we're developing a whole series of other ancillary services that will support care so that long-term care homes are able to deliver a more acute level of care directly in the home to prevent those transfers to emergency departments. So we're really kind of trying to place a circle of care around each long-term care home to know that we're there for them and that we're partnering with them and that they're supported. And I think one of the most meaningful quotes that we've gotten from our long-term care partners so far is they came and then they stayed. This is a sector that has long been kind of ignored, and this was one of the first programs to ever outreach to them. And I think they're so grateful that we are there and that we are invested in. We're going to continue to support this beyond COVID and beyond the pandemic.
Right. I mean, I think we took a real leadership role when no one really knew what to do, and we really stepped up. Okay, Sacha, I'm going to turn it back to you. So we are sort of, I would say, in the middle of what we know about COVID. We've started to lift some restrictions. This morning, I hear that in Bellwood Park, they're painting circles on the grass so many people don't show up. But we don't know what really is ahead. And we know that over the last couple of months, and we've heard it in the news, that many people have not been able to come into hospitals to get the care they need. You're a cardiologist. I'm sure you are closer to this than anybody else. What can you tell me about what Women's Virtual is going to be able to do to help alleviate that backlog, and what our model allows us to solve that other models don't?
Sure. So I think the first thing is, our model of care, and a lot of this was Laura's leadership, is built to last. So, the first thing is this was integrated into our strategy from the beginning. This is what we wanted to do. This is who we are. And that really matters because there have been a lot of, obviously, healthcare organizations, hospitals, others that sort of stood things up in a pretty quick way. Yeah. And as the pandemic sort of wanes, what's going to happen is many of those things are going to come back down because they've got to get to this wasn't part of their strategy, and they've got to get to the business of, taking care of people, within their four walls. And that's fine. But I think where we why I think our strategy really matters is we are pivoting to now begin to say, how do we use the tools that we've built and the infrastructure that we've built to service a large swath of people to get them the care that they needed as it's been backlogged. So I'll give you a really tangible example. Getting in to see a dermatologist for a skin condition like skin cancers and that sort of thing can take months in Ontario. We've actually built an entirely virtual service where patients can take pictures of their rash, lesion, mole, possible melanoma, and then send it in to us, uploaded it securely. Our doctors will look at it asynchronously, meaning they'll look at the picture and then they can decide what to do with the picture. And we've been able to completely virtualize our dermatology service. That type of, and it's completely private and secure. Why that really matters is now with the backlog of cases that are there across the province in dermatology, we will be able to scale up the kind of service that we can provide, not just for patients at Women's, but for patients all across the healthcare system. The same thing we're going to be able to do, in mental health. We're one of the first hospitals that's offering completely virtualized group therapy for people struggling with mental health conditions. Why that matters is it's going to be very hard for a long time to bring groups together.
Right.
And group therapy is efficient and it allows people to get the services that they need and it's effective. So if we can now virtualize that, we can have one psychiatrist or one psychotherapist giving entire groups of patients therapy. It's going to significantly reduce cost and also keep people out of hospital and reduce backlog. And the third thing that I would say is in our surgical services. So, we've been doing this, as you know, for a while with our same-day knee replacement. But the idea is we're going to make it even more efficient because, as you know, surgeries have been really backlogged. We're streamlining the process around surgery to basically get rid of in-person, face-to-face, preoperative and postoperative follow-up.
Right.
So basically the only time that you'll need to come to the hospital at Women's is to actually get your surgery. Everything else in terms of your follow-up afterwards and in terms of your visit with the doctor beforehand will all be done virtually. That's going to significantly increase the amount of time that a doctor can actually spend operating and much less time doing administrative work and and clerical work in the office. And so as a consequence of the kinds of things that we're building, we think that Women's is really well positioned to be able to actually support the province in getting some of the patients that their care is needed, getting it done quickly and saving the system a bunch of money.
I know it's difficult to put a number because particularly of COVID-19, but it seems to me what you're saying is that if we do this right, if we actually innovate and hold on to the gains that we've made, and we allow women to take this leadership position, that we could make patient care better and more efficient, and that in a way, we will also save the healthcare system a great deal of money.
Absolutely.
Can you talk a little bit about that?
Sure. So, the key thing also that I think is critical in what the Women's Virtual Program does that I think is very unique is we, again, virtual is our strategy, but our goal is not just to build a virtual care system for the patients that touch Women's College.
Right.
Our goal is to change the entire healthcare system into this new way of thinking about it. And it is not a small ambition for a relatively small hospital. And we're going to do that three ways. The first way is, everything that we do is grounded in research. So we study cutting edge research and development. I think the one thing that COVID has taught us is you have to listen to scientists because they're the ones that are on the front lines that are doing this kind of work, and they're building the innovation that's ultimately going to be the thing that's going to be scaling up, and ultimately going to be, supporting delivery of care into the future. We've seen that with everything from testing, vaccines and that. You gotta have science grounding everything that you do. The second thing is we're piloting everything at Women's. So we're going to test it out here on real patients to make sure, and we're going to study it to make sure that it works. And then the third thing that we're going to do is we're going to scale it. So we're going to make sure that we work with government, the private sector, and others to really be able to, again, with good evidence, at our side, be able to make the argument that this needs to be scaled up, across multiple hospitals and health systems, not just in Ontario, but in Canada and around the world. So one example was we did a large study of, secure messaging in primary care. And what we found was that we were able to avoid using virtual care platforms. Almost 80% of the visits that were done virtually were things that probably a patient would have either had to come into hospital, go to their family doctor, or walk-in clinic, or even the emergency room. We found that if we were able to scale up just that pilot to the province, we would save the province $5 billion a year in avoidable visits. So the point being is, and that's just in one thing. Imagine when we start looking at all of these other programs that we're doing and the way that we're doing it. And I think that's really important. It's not just doing it. It's purpose built to ultimately scale these things across the healthcare system and save the healthcare system a bunch of money and improving care. The way that we're doing it, I think, will have maximal impact on the way that we deliver healthcare in this province.
Thank you. Laura, one of the things I think that if you work in the healthcare system, this is a very exciting time, despite the fact that we're in this global pandemic, because you're seeing all this innovation, you're seeing all this adoption, all the things that we've been sort of going around the world talking about. People, their ears are open to now. Why is it important that we continue and expand now and not, sort of pause and go back? Why do we have to move forward now?
So I think one of the big reasons that we're seeing that we need to continue to go forward is the ongoing need for COVID. I think we're all starting to realize that we're going to be in this with physical distancing restrictions, at least for the next year, perhaps even longer, which always limits the number of people that can come into the building. In the immediate term, there's also extra costs associated with each visit that we're now seeing the hospital have to bear. So initially, or historically, we've always known that there are costs to patients every time they need to come to the hospital. They have to take time off of work. They may need to arrange for childcare. They may need to arrange. They may need to pay for parking when they get here, and now there are some additional costs. So we have to give masks to everyone who comes in the room. Our providers need to change masks every time we see them. And then there's also a risk to the patients and all of our healthcare providers that there's now an increased risk of infection. A lot of these frontline workers are putting themselves at risk. There's a mental health toll that this is taking on all of our providers, and we really need to be taking care of each other. And virtual is a way that we can do that and limit some of those risks, reduce some of those costs that we're seeing across the system. And then furthermore, we're seeing a complete transformation across the health system. We're thinking of new ways to deliver care, and whenever a transformation like this happens, it uncovers other areas in the system. And it means, if we're saving, as Sacha pointed out, $5 billion across the system by implementing this, that means there's $5 billion in the system that we can invest somewhere else that really needs the care, places like long-term care. So there's a lot of those advantages across the system for how we can achieve further savings by using virtual.
Okay, Sacha, I want to talk a little bit about what we've already been doing in evaluation, because this is an area you lead. We affectionately, as I said off the top, call it Weave. And one of the things that I think that as a layperson, it's hard to tell, how do you know what's working and how are you using Weave? So many things are happening all at once right now. Everybody's, rushing to the front of the line to become virtual. And I'd like you to talk about two things. A little bit about the difference between being digital and being virtual, because a lot of people talk about digital tools. And I'd like you to speak to how evaluation plays a key role in holding on to the gains that Laura was just talking about.
Sure. So I think you're right, Jennifer, that, this is obviously, we've a bit become the belle of the ball now because, a lot of people realize the value of, virtual care. So here's what I would say. Research and development has always been sort of the cornerstone of the work that we've done at Women's. It has to be because this is a new area. I mean, medical research has always been critical as we roll out new models of care and new ways of doing things. I mean, we do it in cancer research, we do it in cardiac research. Virtual care is no different. It's just a different way of practicing medicine with a different suite of tools than, say, a surgical knife. Now we're using an iPhone. So, we should consider this just like any other type of medical research. So I think one of the things that I always say to people is virtual care at its very simplest is care that's disaggregated from time and space. So, and I say that because it's not just about technology. So digital is like apps and wearables and things that go ping. It's all about the tools. Mm-hmm. Virtual care is about a philosophy and developing systems of practice, new ways of doing things with doctors and nurses and physiotherapists and other folks with patients coming together to figure out how we deliver care in a very, very different way. And it requires a whole multidisciplinary team of specialists and scientists that do different types of things. People who understand behavior change, people who understand, how to measure things, are evaluation scientists. People who have content expertise in dermatology or cardiology or whatever, people who have expertise actually in the tools themselves and how to build tools that will meet the needs, because the tools for a cardiologist are very different than the tools a dermatologist would need. It would be silly to think that they would both need exactly the same thing when they treat two very different conditions. So there's a whole team-based approach that goes into this. Because as I said, our goal is not just to implement what other people have done and hope that it works out. Our goal is to really push the envelope, and we've really just scratched the surface on what's possible. And I say that because, the goal of a virtual healthcare system that's connected is not just to do FaceTime with our patients, but is really to, be able to manage chronic disease, for example, in a whole new way. And that is to ensure that patient experience is better, to ensure that their outcomes are better, meaning that they live healthier and longer lives, and that the system becomes sustainable, meaning we become more efficient in the way that we deliver care. I'll give you a really good example. So a good friend of mine is a lawyer, and she, she's a big corporate lawyer, and she bills $500 or $700 an hour. She had to sit at her doctor's office for 3 hours waiting for the results of a blood test. That was normal. To the system, to the healthcare system as it was currently built, that didn't cost us anything. It just cost the doctor's visit. But to her, that cost her 3 hours of billable time. Which was, ridiculous. And at the end of the day, when we build a system that works and we take into account and measure the impact on the publicly funded system, but also the impact on patient convenience and time and the outcomes that they have and the experience that they have with the system, and we demonstrate that to the payers, not just government, but private sector companies, suddenly these things become more sustainable. They become the new way of doing business. And we think healthcare for far too long has been way behind the banking industry and many other industries in the way that care and service is delivered. And we think it's now the time that we can deliver it in a much more patient-centric way.
I love the passion that you have around that, because I think that I used to work in a bank when I was in high school and university. And I worked in the bank at a time where everybody lined up on Thursdays with their paycheck, and the line went out the door and around the block. And no one would accept that now. No one, my kids won't even believe that we used to do that, and that you couldn't get money out of an instant teller. And when I think about the healthcare system, there's so many correlations to how system-centric it is as opposed to patient-centric. Because like in banking, you could only get your money while the bank was open between 10 and 3, and that's, you know, the famous banking hours. And now you can get your money 24/7. You can do almost anything. And I think a lot of people would have thought that that was impossible 30, 40 years ago, that we have this 24-hour, you know, customer-centered world that is international and borderless in terms of banking. And I think that that's the same kind of sort of patient-centered activity that we want to bring into the norm here at Women's and beyond. I want to talk to you a little bit about what are we doing with the provincial government currently that demonstrates that, you know, our leadership is being taken very seriously, and we are the go-to sort of players in this field.
Sure. So, you know, for the last couple of years, we've been designated as the Center for Digital Health Evaluation by the province. We've been the the designated preferred center for evaluation of digital health investments in the province. So, what that means is our scientists and our doctors are engaged in giving advice to the government and supporting the government as it decides, is it going to make a big purchase, for example, in big pieces of provincially oriented technology. So whether it be Zoom for the province, whether it be a secure messaging software for the province, whether it be a way of connecting x-rays and other radiology images, they've always asked us to help evaluate how that's implemented and how it's being rolled out. And just for this room among friends, one of the things that we're going to be doing is evaluating for the province, how well digital health has enabled the health system response to the pandemic. And there are a number of policy questions. Many people know that there are now billing codes with the Ontario Medical Association, so doctors can bill to do virtual work. Well, we're going to be evaluating the effectiveness of that so that we can provide information back to government as to whether or not these are working. Is it effective? How does it need to be tweaked to optimize things? And I think it's a smart move by the government to have scientists and folks that are experts in this, like they would again in cancer or cardiac care, provide them advice on how to build their system.
Okay, so I have my final question before we open it up to the group. We're going to talk a little bit more about government, and I have two final questions in sustainability. So we've been hearing announcements about the federal government making investments in virtual. What are your thoughts about why we can't just rely on the federal government? How far will that investment go and take us? And why do you think that more needs to be done than what we're hearing from out of Ottawa?
So I think it's a great point, right? And look, I sit on one of the federal panels that's going to help figure out how to dole out that money. The reality is that, government is really good at writing checks, but they're not necessarily the experts on how to implement things on the ground. I mean, one just has to ask the question, if we left it to government to run all the COVID testing in the province, I mean, look at where you are, So the reality is you need partners, and you need the people who know what they're doing to be able to support and provide advice on, and not just advice, but actually provide the latest cutting evidence and research on how to actually do this kind of thing. Anyone who thinks that virtual care is going to be, and a new way of doing things is going to be solved by buying doctors' Zoom licenses is dreaming. It is a complicated system of figuring out, payment strategies, regulatory strategies, clinical guidelines, all the way down to how you engage patients in behavior change to really make the system go. And anyone who's been in any complex system transformation will know that. And that's why I think what you really need is government has to be an important partner. And I'm absolutely thrilled that the federal government through InfoWay is interested in funding some of this work, but they need trusted leadership, in the sector to do it, which is why they're asking us as an example.
Yeah.
Okay.
Can I add to that? I just want to say also that, the government doesn't really fund untested programs, right? So they're going to be testing the things that they're going to be funding all of the things that we've already tested and done, like video visits and group visits and all of the things that we've already talked about on this call. And where I think philanthropy can play a big role is helping to launch us to the next level and galvanize us and all that we've accomplished. And there's really like a short window to get us where we need to go and position us as a leader. And I think we are, we have demonstrated our leadership in virtual care, our ability to scale very quickly, our ability to lead in this area. And I think philanthropy can play a huge role in helping us bring virtual care to the next level.
Okay, I'm gonna end with this. So some of the folks that have joined us this morning were our early adopters, and we thank them so much because of their belief in us and our philosophy that we were able to do all the things that we've done, particularly during COVID and even before. And in the invite, one of the things I stressed was that we are looking for sort of the next infusion to, hold the gains that we've made, a $10 million infusion into women's virtual, because I really feel like we're at this fork in the road. And on one side is going back to the system we have, which has been around since the 1950s. And on the other side is the new way of doing things. Sacha, what will $10 million, how will that accelerate what we're doing? How will that make a difference in a multi-billion-dollar system? How will it help us get to another level? Oh, your mic's off, Sacha.
Right.
This is an important answer.
Virtual care guy can't use technology. So I think when you look at this, the way that our approach, it's designed for maximal impact. So one is we be doing the research and development. At the end of the day, nobody else is doing that. And so I think that's going to be critical. Second, it's really about, as Laura says, clinical implementation. We have to push the boundaries of testing the things that are currently untested and unfunded. So, push the boundaries on remote patient monitoring, on the use of wearable devices integrated into clinical, really pushing the boundaries on what we can do in surgery and in the management of clinical. And then finally, it's the spread and impact piece. Getting the scientists and the key people to do things like the economic analysis about the potential cost savings and benefits to the system, that we can actually spread this, not just at women's, but to all of the other hospitals. So although 10 million might seem like a lot, the impact in a $1 billion healthcare system could be massive. And that's really the goal of this whole thing.
I'm going to end by thanking Dr. Bhatia and Laura Puss for joining us for our very first webinar and our conversation on Women's Virtual. And I want to thank those of you who took the time to join us. This is a conversation that we've been eager to have because we really feel that this is a very special moment in history, really. Many of you may know that Elon Musk, who many people admire, is going to be launching his rocket into space with people on board on Saturday, his Falcon Heavy rocket. And many people told him, and he talks about it all the time, that it couldn't be done, that it was impossible what he was trying to do. It was too big, it was too heavy. And our own founder, Emily Stowe, the first female doctor in Canada, was also told she would never be a doctor. And I'm sure she was told she could never open a hospital. Here at Women's College Hospital, we are the dreamers, and we believe in a big dream for our healthcare system, and we're not willing to settle for going back to a system that was developed for a 1950s society with 2020 pressures and a global pandemic. And we hope that after you've heard this conversation, you believe what we believe, and that you believe that we can change the healthcare system. You believe that Women's College Hospital has the tools to do that, and you believe that we can leave a healthcare system in better shape than we found it for our children, and that can be our legacy. So thank you so much for joining us. We appreciate your time. We look forward to following up with you who joined on the call to hear your feedback, and hope that you will want to be part of this next journey as we change the healthcare system so we have a healthier, more equitable world. Thank you so much for joining us. Have a wonderful day.